So welcome. This is another Project You nutritional therapy webinar. This was our February webinar. It was supposed to be last week, but we're having it today. Um, Sorry if you can hear my cat crying in the background, but that's just part of real life. So as I said, this is another Project You nutritional therapy webinar. My name is Whitney Isles. I am the nutritional therapist for Project You. And this month we are covering ARFID and disordered eating, and especially kind of thinking about ourselves as neurodivergent women. It's important to understand that I'm not trying to put myself forward as a specialist in this area. I have some experience in this area, professional experience, personal experience, lived experience as well. So I'm blending all of these models together with some of my own kind of thoughts and feelings on these matters as well. Now, it's important to understand that this webinar is for educational purposes only. It's not a substitute for medical advice. So always consult a qualified healthcare provider before making any changes to your health, nutrition, or lifestyle. Now, just some housekeeping here. So we're choosing to always do this in webinar format just to kind of keep things as private and as safe as possible for the Project You members. So if you do have any questions throughout the webinar today, just whack them. You can either whack them in the chat or put them in the Q&A, and I can answer it kind of as I go along or at the end of the session where we will have a little bit of time for Q&A. But the idea is this being a kind of a low pressure space. And I've said the chat box is open, and just this webinar is going to be a little bit more sensitive than some of our other ones, and we will be covering kind of food and eating difficulties with a little bit of kind of going into trauma, childhood trauma, relational trauma, and thinking about mental health. So it's always important that you really think about kind of what works for you when you're kind of listening or kind of working through these kind of webinars with us. And if at any point you need to kind of just go, or you want to go and come back, or you want to go and then just watch the recording, all of these things are fine. And the recording and the slides will be shared afterwards, and we'll make sure, especially on the recording, that there are the closed captions are on. I'm not sure how to do those directly on the webinar, so I'll make sure that they are on the recording. So today's journey, what we're going to do, we'll have a 60-minute webinar. This is going to be broken down into slots of 10 minutes. So first of all, we're going to be thinking about kind of what is ARFID, what is it, how it presents, and the neurodivergent link. We'll be thinking a little bit about disordered eating. So it's important to know that we're not covering eating disorders. That's something separate. What we are thinking about is disordered eating and why, as neurodivergent women, we're often missed. We'll be thinking about safety in the nervous system. If you know me and been to some of my other webinars, especially last year, you know I really love to chat about safety and the nervous system. So we're going to be doing a little bit about that. And then we'll be thinking along the lines of relational trauma and disordered eating, especially in relation to kind of like emotional neglect, control, self-abandonment, and these kind of things. And then finally, we'll think about some support and some strategies for those of you who might kind of want to know more about that, or want to help loved ones or friends and family, or practitioners that might be watching this thinking about kind of working with your own clients. And at the end, we'll have a kind of 10-minute Q&A. So again, if you've just joined, if you have questions, feel free to put them in the Q&A and I will answer them at the end, or if they're relevant, I'll do them as I go along. If you see me looking over to the side, it's because I have another screen here, and this is kind of where my chat and my questions are. And again, apologies if you can hear my cats in the background. They do not like it when I work in the evenings. So let's start with the kind of the understanding of ARFID. So when we say ARFID, we're thinking about avoidant restricted food intake disorder, and kind of what this really means for neurodivergent women, right? So avoidant restrictive food intake disorder, it is a feeding and eating condition characterized by a highly limited range of accepted foods. And it's important to understand that unlike other eating disorders, it's not driven by body image or concerns of weight. This is more around, sorry, let me just do this. It's more around sensory aversions, fear of eating. So if that's kind of choking or vomiting or just a low interest in food. And it's important to understand that when kind of psychiatrists or doctors or kind of whoever are working through these disorders, it's important to understand that this is not caused by, or this is not diagnosed when there are medical causes that can explain the symptoms. For example, if you're on particular medication that really kind of decrease your appetite or kind of that kind of make you just not want food, right? So the I can hear things smashing in the background. The diagnostic criteria would always rule out, are there other kind of causes of some of these symptoms or of kind of ARFID, right? And it is recognized in the DSM-5. It's distinct from anorexia and bulimia. So these would be your eating disorders because it's not about how you look and it's not fussy eating. And I think it's really important, especially with like kind of sometimes with social media kind of content and kind of all the different information out there, it can be seen as, oh, you're just a fussy eater, you know, or you just want your beige foods, you know. And it's important to understand that this is a diagnosable condition and it can have kind of, it can impact someone's kind of health and nutrition and daily life. Okay. So again, we're not looking at just picky eating, you know, especially when we're thinking about kids, but when we think about adults. So when we're thinking about picky eating, we see that preferences can shift over time. And eventually what we might see is trying new foods. There's a minimal impact on nutrition and social eating is broadly manageable. But when we're starting to think about ARFID, what we might think about is something that's a little bit more persistent and it's often lifelong without support. New foods can cause genuine distress or panic, and that's a really important thing to understand, right? And it doesn't mean that there's anything wrong with you if foods can cause distress and panic, and we'll go into that in a little bit more. We know that ARFID can cause nutritional deficiencies and kind of social eating as well can cause significant anxiety. Okay. So it's important to understand that this is a clinical diagnosis. It's not a phase, it's not a preference, it's not a choice. It's someone's kind of relationship with food and interactions with food, okay? And this kind of sensory experience of food is really, really important, okay? Um, because ARFID is often driven by the sensory sensitivities. And this is where we can start to see where that overlap between something like ARFID and neurodivergence can kind of come into play, right? So food is intensely multi-sensory, and for many neurodivergent people, each of those channels can be a source of genuine distress. So we could be thinking about texture, appearance, smell, temperature, and taste intensity, right? So if we kind of had a bowl of blueberries, we know that blueberries are really great for us. They're really great for kind of antioxidants. But what might happen with a bowl of blueberries is each one of those blueberries might taste or feel kind of very different. So you might have a larger blueberry that kind of is a little bit more squishy when you bite on it, where you might have a smaller one that is a little bit harder. So the textures of kind of what you know we get taught in nutritional therapy, for example, the textures of kind of good foods and healthy foods actually might be quite distressing and might be quite unnice for someone that has these sensory sensitivities due to how different they might be kind of all in one go, right? It might be, you know, something like overnight oats. It doesn't work because it's just too slimy. I know with like chia seeds and chia pudding, it just might not work. It might be very off-putting. Um, it's important to understand, oh, sorry, the title was a bit off there, that there is this kind of significant overlap. And we know that kind of when I was doing my research to this, like the research kind of differed, and it's really important to note that I think there still needs to be a lot of research in this area with the ARFID and neurodivergence and this overlap. But I was looking at anywhere between 11 and 21% of autistic people also met the criteria for ARFID, whereas 23% of people with ARFID also had ADHD. So we're looking at about what a quarter of people that are diagnosed, and in some cases this might be kind of higher if we go into the data a little bit more. So the connection we're thinking about is this kind of sensory processing difference, right? Especially when we have heightened sensitivities. You know, some of us are in our bodies and feeling everything and struggling to regulate our temperature and processing the lights and the sounds and kind of the electricity, all of the things that are going around. So there's already a nervous system that is highly sensitive. So it registers food input more intensely. We also might find that for neurodivergent people, there might be a kind of more kind of rigidity and need for routine, and foods can disrupt that predictability and genuinely feel unsafe. So similar with like the blueberries. So I could tell a client, have blueberries every day for your breakfast, or a bowl of blueberries would be really great for your recovery. And actually, even that, even though they're having a bowl of blueberries every day, that bowl of blueberries can be very different every day. So that kind of that lack of safety, that lack of a ability to kind of is this thing going to be the same every time? And we're going to talk about, like I said later on, this kind of nervous system and relationship with safety and how this all plays in with food. Again, we might find that there's interoception difficulties, so understanding the cues for hunger and fullness, and that just being harder to read and trust and kind of know what's going on with your own body. And again, anxiety, so fear-based avoidance that can generalize to more foods and contexts over time, right? So I think this is especially kind of potent with something like EDS, where we know that there's a lot of GI symptoms. So we know that there can be reflux, there can be pain, there can be constipation, and how that can kind of translate into the avoidance of food. I know I have had clients again with nervous system issues and difficulties to kind of get into that rest and digest. And what they're also dealing with is a lot of acid reflux, a lot of aversions to food. So they're eating food, they want to eat food, but when they're eating food, there's a lot of gas, there's a lot of bloating, there's a lot of constipation. And actually how these things in the neurodivergent body can really mean that you just don't want to eat, that kind of there becomes this fear associated with food. I had a client that I was working with once, and when they came to me after working with another kind of nutritional therapist who wasn't specialized in neurodivergence, and that's not to any shade on that one, they'd gone through the kind of the normal protocols, and actually what had happened is their window of tolerance for food has become so small, but also their psychological tolerance for food had become so small, and they were so rigid and strict on what they were eating. It almost kind of became a disordered eating within that, because of the avoidance. And we created the protocol, eat the burger, like eat the burger. If you're going to have the reactions, like how could we rebuild that kind of psychological safety with food kind of thing, right? So moving on to kind of disordered eating, and I know that I'm throwing a lot of information at you. These are big topics, right? These are huge topics, and we have an hour or 15 minutes with some Q&A. And this is why we provide the recording so you can go through it afterwards, right? So this kind of disordered eating. So ARFID is considered an eating disorder, but we're not going to go through all the other eating disorders. I wanted to take a little bit of time to think about disordered eating. And the reason why is partly last week was kind of last week in February, so we're in the beginning of March, but last week was raising awareness on kind of disordered eating and eating disorders. So it felt right to do it around this time. But also, if you remember back to last month, we started to look at calories and macros. And I wanted to start with the calories and macros and then kind of think about disordered eating, because I think especially, with neurodivergence, with kind of some of the traumas that we go through within life, being neurodivergent women, and especially when we're being diagnosed later on in life, we can get very particular around food. And it's important to not just kind of look at calories and macros in isolation, and understand that actually that also kind of creates risk for disordered eating, because we can get too caught up in kind of the rigidness of we have to have this many calories and this is what our plate needs to look like. And that within itself can take up a lot of spoons, but also kind of tap into some of our own kind of needs for control and kind of shame and the things that might be going on underneath the surface as well. Sorry if you can hear my cat in the background. He does not like it when I shut them out of the office. So when we're thinking about disordered eating, we're thinking about a range of irregular eating behaviors that may not meet the threshold for a clinical diagnosis, but still significantly affect well-being, nutrition, and daily life. So this can include chronic restrictive eating. This could also include binge eating episodes, obsessive food rules, like only having safe foods, using food to manage emotions, extreme avoidance of food groups, skipping meals due to overwhelm or executive function, or executive dysfunction, really, high anxiety around eating socially, and other kind of rigid eating patterns. So how it can show up for us as neurodivergent women, I think it's important to understand that a lot of the times kind of we don't fit the kind of the typical textbook descriptions. So what it can look like is eating at certain times. And I think that can work a lot when we start to think about the world of fitness and having kind of strict gym routines and intermittent fastings and kind of being very kind of fixated on food. So on one hand, we can go that way. And then on the other hand, where we can have kind of difficulties with executive dysfunction, and that can make kind of planning and preparing food at times feel completely impossible, right? So for a neurotypical, what we might find is they'll go, oh yeah, I just need to go cook some food, right? And that's one step for them. Whereas for us, it might be, oh, I need to go check. I need to get to the fridge. I need to open the fridge. I need to check in the fridge. I need to see what ingredients there are. I need to figure out what these ingredients can make and all of these things. My cat is very distracting right now. Emotional eating and dysregulation. So food as a tool for nervous system regulation, not just weakness, but as a logical coping strategy. So for example, earlier on, I wasn't feeling the greatest. And I know it's about to be Shark Week. I know that's a bit TMI, but I was like, actually, in order to help regulate my nervous system, what I'm really craving right now is some hard sweets to suck on, right? Something that's going to help like soothe. So there's something in the stimming and the self-soothing with something that might be kind of more sweet, that might sugary or kind of harder candy. So there's also kind of ways that eating can help us kind of we eat emotionally and we have this dysregulation. This rules of tightening under stress. So texture, temperature rules that are manageable in calm periods, but get kind of harder to manage in high stress, right? So if you're in a low stress day or a low stress period, you might kind of really like a salad and some chicken and some avocado. But if you've got a lot going on and your sensory kind of your nervous system is in this sympathetic state, then it's like, no, I just want some toast and butter, maybe a banana, but toast and butter is probably going to be it, right? Forgetting to eat and then binging. So this kind of hyper focus and go, oh, I haven't eaten in 3 days. And let me eat everything in sight now because now I've just realized that I'm hungry. And then kind of getting into that place of burnout. And again, not having that kind of executive functioning or cognitive functioning to actually be able to kind of manage food, right? So as soon as we start to get into burnout, food tends to be one of the first thing that goes, oh, let me get a takeout, let me get this. And, then all of a sudden it's been like 2-3 weeks and it's like, oh, when was the last time I had a vegetable? And it's like, okay, so this kind of relationship with food is then kind of progressing that burnout and we get caught in that little bit of a loop. And again, kind of avoiding social eating because it can just be exhausting, kind of going out to a new place, choosing food and all of these kind of things. I'm sorry, I do have to do this. I do. Can we chill, please? Come on, you coming up? Come on. There's people on the thing. This is Azzy. He's being problematic. So yeah, so avoiding kind of social eating, just and again, sensory processing, going out into restaurants and kind of having to deal with everything. Personally, I hate it when I go to one of my restaurants when I've got safe food and they've changed my safe food order. And I'm like going to the restaurant, I know what's on the menu, I've been there a million times. And then all of a sudden, that one thing that I know is my safe food in this restaurant is no longer on the menu. Like, what is that about? I feel like that should be something that is completely and utterly banned in life. So then there's this kind of emotional weight of food. So shame and isolation, feeling broken and embarrassed, social withdrawal. I think kind of one of the things that we don't think about enough is grief and this kind of and how grief shows up in many different ways. And one of those ways is like mourning the normal kind of typical neurotypical experiences around food, being able to travel and be spontaneous and have shared meals and kind of that not being as kind of easy for us, having to think about, okay, especially when we're thinking about kind of MCAS and intolerances, oh, I can't go to this place, they don't have any gluten-free, I can't go to this, and that kind of, oh, am I going to be seen as picky? Am I going to be seen as kind of, oh, is anyone going to judge me for what I order and what I eat? And that kind of the grief that we feel for not being the same as our neurotypical counterparts kind of thing, right? Anxiety loops of kind of fear of running out of safe foods, or kind of when we're traveling or there's change and there's a disruption in routine, being told it's a phase or you're going to be kind of, you're being difficult or and internalizing that, right? Especially as a kid or a teenager. Why don't you eat that? Eat your plate. Don't you know, like you need to eat all your food, stay at the table until you've eaten your food, like these kind of cultures and dynamics in our families and how that can kind of work into self-blame and how that gets internalized. And again, this kind of burnout cycle, right? That kind of makes it even more difficult to prepare food and eat foods that are good for you, but you don't quite want it. You want that big old packet of what's it. I say that because that's what I had at the weekend. Okay. Just is what it is, right? So the other thing that we're thinking about, because I am kind of thinking about kind of neurodivergent women, those who identify as women, also non-binary, trans, we're also always thinking about these kind of uh, gaps in diagnosis, kind of gaps in kind of how we are seen, how we show up in research. So we know like a lot of the research was traditionally kind of built on studies of young boys and young white boys at that. So we know that even now that, you know, the rise of social media, the rise of more campaigns, women and girls are starting to see a lot more, are being a lot more seen and recognized. But even then, it's still behind. And I think even when we go into thinking about girls, women, non-binary, trans, when we're also thinking about, is there a difference between black and brown people, people of color? Like there are so many subsections of that where there's still a lot of invisibility. And kind of ARFID and women and disordered eating can also be kind of misread as dieting, anorexia or OCD. The same way there's misdiagnosis in relation to like personality disorders and stuff like that, right? Um, and just kind of not understanding the sensory issues and the anxiety. And a lot of the time I see these things and I train up a lot of practitioners and everything is like, oh, they're just attention seeking, they're just attention seeking. It's still language that is very much used. um just check and see if there's any questions. And I think there's like a lot of masking that's going on. So masking is the act of camouflaging neurodivergent traits to fit neurotypical expectations. We often mask our eating difficulties too at significant cost to our own nervous system, right? So we might order something that is acceptable and then not eat it, make an excuse like, oh, I ate earlier or I'm not hungry today. We might kind of plan meals extensively in advance to appear normal. We might fake our enthusiasm when we're feeling genuinely distressed. We might be eating a distressing food to avoid just drawing attention. I know, like, family events or big events or going to a partner's house and like, their mum is cooking food and you're like eating the food even though you know that you don't like it. And I think it's like this performance, this masking that we do is exhausting, and it can also affect our relationship with food when we can't just kind of be ourselves. So every performance costs the nervous system resources and is often leaving nothing left for meals. Masking around food can be exhausting and is invisible again. So it's another one of these invisible things. So I wanted to take a moment to think about this kind of not to think about late diagnosis as well, right? So many women receive their ARFID or their neurodivergence diagnosis in their 20s or 30s or sometimes later, after years of being told or feeling like something was wrong with them, right? So this kind of before diagnosis, there can be years of shame, confusion, and self-blame, mixed diagnosis, being told it's a phase, being difficult and developing coping strategies entirely alone. And I think that kind of loneliness is really important to acknowledge. After diagnosis, what we might find is we have a relief for finally having a name for our experiences. Again, grief shows up, grief for the years spent not knowing, oh, that version of me was dealing with this and no one saw it. And this version, oh, I behaved that way because of this, and that kind of what if people had known, what if I had known, how would have things been different? And being able to grieve for those kind of different versions of ourselves and those years spent that are not knowing, having access to, proper support and language, and having a community like Project U with others that can kind of really understand what we're going through. So My cat is currently wrapping its body around me, but I think he's starting to feel safe and have a calm nervous system, so that's all good. So safety and the nervous system, why feeling unsafe in our bodies shapes everything about food. And I think this is a really important part, right? This is the part that I find super interesting. You're cool down there, aren't you, buddy? All right. So I think it's important to know that, you know, with our nervous system, it's always asking this question as, am I safe right now? This isn't conscious. This is happening kind of underneath our awareness, but it's something that's kind of constantly happening, and we're constantly kind of scanning our environment for threat. Oh, what happened there? Give me one moment, guys. Oh, it would happen in Mercury retrograde, wouldn't it? Where did my presentation go? Right. I've got it back. Right, can you see that now? Sorry, I lost it then for a second. Yes. Okay, so I have to remember where I was at. So this kind of scanning the environment for threat, especially when, like most of us have had, there is some childhood trauma there. So there's already this hypervigilance in our nervous system, right? So our nervous system is already hyper aware, or even if we have more sensitive sensory input, right? So if we have nervous systems that are processing a lot of sensory information, that is also going to kind of keep us on this high alert. So we're going to be more sensitive to the sounds around us, to changes around us. So our nervous system is always scanning to see how kind of safe we are and how safe we're feeling, right? And there's ways that the body can learn that food is unsafe. So when we're kind of operating in this chronic low level state of alertness because of our sensitivities, food is inherently unpredictable and can become one of the clearest triggers for that threat response. Not always, and this is not for everyone, right? But this is just a part of this topic that I wanted to touch on, right? So unfamiliar food is encountered, nervous system registers as threat. We might have a distress response. There might be avoidance that provides relief. And then the brain learns avoidance equals safe, right? So we don't eat the food, and then that means that we're safe. And we keep learning that the avoidance provides relief because it's this kind of inability to sit with the discomfort of it. And part of that, again, is due to some of the experiences that we might have had in life and a need to feel safe and a need to feel in control. So it's not always this, but it's just a part of this bigger subject that I'm particularly interested in, right? Um, it's not a choice. It's not like we're consciously doing this. It's a learned protective response. And the nervous system is doing exactly what it's designed to do, which is protect us, to keep us safe. And with every successful avoidance, it reinforces this pathway that the danger signal for that food can get stronger over time. Over time, the avoidance can circle and widen and include more foods, especially kind of more context for feeling threatening. The nervous system is not broken, it's overprotective, and we can change that with gentle support, right? So this is what I mean about kind of sometimes foods are going to cause us distress in our digestive system, right? So especially if we've got something like EDS, hypermobility, where there's issues around our connective disorder, and we might go through a phase where we have a lot of constipation, and that constipation causes pain. And then kind of in that moment of, you know, maybe it's a month, maybe it's 2 months, right? Maybe it's longer than that. In this time, we learn not to eat food or not to eat certain foods, and we avoid the foods because of the relief. We don't want the pain, we don't want the consequences, we don't want the reflux, right? Or we don't want the different textures. Maybe we're burnt out and there's something around the textures that feel odd, and it doesn't feel safe, you know, to have mashed potatoes, to have these things. And then, you know, within 3, 4 months, 5 months, what we find is that we've become very restricted on our foods because of this kind of avoidance and this unsafetiness. And it then becomes something that actually we need to do some work on in order to move forward from. It's not something that you can just wake up overnight and go, hey, I've realized that I have this thing going on and I'm avoiding all these foods and I need to eat healthy now. Let me change today. It doesn't quite work like that, right? It is something that has to change slowly over time because the nervous system has learned how to feel safe, right? And it's really important to understand this kind of safety and this need for control. When the nervous system feels chronically unsafe, predictability becomes survival. Control over food is not rigid, can't do that word this evening. But it's about regulation, right? So when we say we feel chronically unsafe, that could also mean because we're hypermobile and our joint sublux, and we've also got dysautonomia. So then when our joints are feeling unstable, our nervous system tightens up all of our muscles in order to kind of keep us safe. Because, oh, this is a bit too kind of flexible here. We're going to have to tighten these muscles around it in order to make sure that this joint is safe. So therefore, we have this kind of chronic pain, and that kind of again uh, feeds into this feeling of unsafe, or in this world that's unpredictable. Or we might have a undiagnosed parent, and they, because of they're not diagnosed, kind of our relationship with them has felt very unpredictable over the years, and therefore there's this extra need for safety and control, right? So then how do we then kind of start kind of controlling the things in our lives? And one of the ways that that can show up, not always, but it can show up, and it doesn't mean that all of these symptoms are because of that. It can show up in our eating. So eating specific foods or brands because change feels too big, it's too unbearable. Needing food prepared in the exact same way every time. Strong distresses when safe food is discontinued. Rigid meal times and routines, or an inability to eat when the environment is unpredictable. And kind of what control is actually doing, right, is it's reducing the unpredictability that triggers the threat response. It creates a pocket of safety in an overwhelming world. It allows the nervous system to down regulate. It preserves energy for everything else in life, right? So these things, when we start to think about it, what's our nervous system actually doing, we can have a lot more grace and a lot more empathy for ourselves, right? And I think it's about respecting this need for control rather than forcing change. It's kind of the respect for it, the empathy for it, the grace for ourselves is where the effective support begins, right? Just the understanding. Because the last thing that you want to do when you are, feeling unsafe is then force yourself to change and force yourself into these kind of big changes, especially around food, which might have all of these adverse reactions. And all that's going to do is bring up more feelings of shame or not feeling good enough, or, what's wrong with me. And these are the kind of feelings that we really want to avoid. So change always requires a sense of safety first. The nervous system will not allow kind of exploration when it is busy managing threat. So when I'm thinking about things like, disordered eating, when I'm thinking about things like ARFID, I'm always thinking about it through the lens of how do we get this person's nervous system to feel safer? And we know that when our nervous systems feel safer, we're also able to rest and digest. Sorry, my cat is giving me Puss in Boot eyes right now. When we're feeling safer, we go into that parasympathetic state, which helps us to kind of rest and digest our food, right? So rest our bodies and digest our foods. We can't really do that in the same way when we're operating in a place of stress, in a place of sympathetic mode, right? So some of the barriers to change, we might be kind of being pushed to try new foods before trust is built. Change happening without warning or choice. Shame-based approaches. Even when people have good intentions, they might go, "Oh, just try it. I know you like it. Just try it." And but like your internal world is overwhelmed. I don't want to just try it. Leave me alone. Give me the food that feels good to me right now. That's what I need, right? The environment is unpredictable or overwhelming. So like if someone is not in a kind of stable environment at home, or if you're in the middle of a move, for example, or you're in the middle of a relationship breakup or something like that, or you're changing jobs, these would not be the times to start working on your food, right? Or if we do work on your food, it's very kind of small steps. And support that doesn't account for sensory reality, right? Or support that doesn't kind of incorporate and understand neurodivergence, and it is treating you like a neurotypical. So it's like if you go to a sports nutritionist or a nutrition coach and they just go, right, yeah, no, I just want you to eat your 12,000 calories a day. And it doesn't matter, all of that has to be, protein, it has to be lean meats, and you have to have your 30 grams of fiber a day, and the only carbs you can eat are sweet potatoes, right? It's not going to work for you, right? It's going to be too rigid. You're looking at things through a neurotypical lens, and even for neurotypicals, I think that's quite hard to do anyway, right? So what actually helps, right? We want to be building kind of safety first. I'm going to keep saying this. We build safety in the nervous system first. What's going to help your nervous system feel safe? And then we're going to start thinking about tiny direct steps with zero pressure, right? So like, creating some foods, or picking some foods up that you want to try with zero pressure to actually eat it, right? This might be, you might chew on it, you might smell it, you might kind of play with it for a little bit, right? And there's no pressure to actually eating it, and taking some of the shame off of it. This predictability, consistency, and being in control, a calm, regulated nervous system in the supporter, right? So if you're eating with someone and you're trying to create these changes, it's important that they're also in their kind of calm and regulated nervous system. It's not going to help if the person that's kind of supporting you is also feeling really anxious. Oh, are you going to eat that? Come on, eat it. I know you need to eat it. It might again be good intentions, but it tends to be coming from someone's own kind of anxieties about things. And also kind of, I think kind of, let's not try to have like the perfect meal. Change might look like having, one piece of broccoli on your plate when you normally have nothing. Rather than everything being kind of, you have enough protein, you have enough carbs, right? It might be kind of, let's see if we can get a little bit more protein in your meals this week, right? It doesn't have to be kind of perfect meals. We're always looking at progress over perfection. Can you see him? He just wants loving. Um, so we're always thinking about this kind of safety approach to food. I'm really like jarring myself because I've seen that we're still on this section 2, and I definitely moved this to section 3, and I did not change it. So we're regulating the nervous system first, right? This could be a day, this could be weeks, this could be months worth of work actually, but we're thinking about co-regulation, breath work, safe environment, reducing sensory load. Then we're starting to build trust and predictability. So the consistent safe foods, no surprises, respecting autonomy and control. Then we want to be kind of a non-food exposure, kind of this low pressure. So being near food, watching others eat, exploring without expectation, right? Sensory play with food. So again, looking textures, temperature, smell with no pressure to eat anything. And then expanding the range, then food chaining, kind of tiny variables that only when the body feels safe to do this, right? So now we're on section 4, right? The other one was section 3. Where are we at for time? Okay, we're doing good. We're doing good. Are there people still with us? I can't see because all of those things closed down when I stopped sharing the screen. So let's start thinking about relational trauma and disordered eating. So this is a subject. This is my subject at the moment. This is the thing that I get quite fixated on. So my background before I got into nutritional therapy, I'm a trauma specialist. Is what I do. I work a lot historically with people that have experienced a lot of trauma, but I also work with a lot of professionals who work with people who've experienced trauma. So I support the supporters, right? But trauma is a thing that I've always been extremely interested in. Again, from my own lived experience, kind of and transgenerational stuff, I don't try to hide that. And I do think that there is this link that we need to explore more between relational trauma and disordered eating, right? And how our kind of earliest experiences of care or its absence can shape our relationship with food. And I think this is the subject that I see kind of talked about less. So when we think about relational trauma, we're thinking about kind of the harm that occurs within important relationships. So often caregivers of the relationships in childhood. It includes emotional neglect, inconsistent care, enmeshment, and environments where your needs were not seen or met, right? And it's important to understand that kind of relational trauma is a big subject within itself. But we can be thinking about things like overt trauma. So the things that have that happened that shouldn't have, So we're thinking about emotional abuse, but there'll be many types of abuse in there, but I don't want to go into all of those for this webinar. It might be hostility, it might be unpredictability, and that unpredictability being around food or bodies, but not necessarily inclusive to that. So that unpredictability could be kind of living in a household where there was violence, for example, or that could be living in a household where the primary caregiver had a mental health condition that meant that they didn't always show up in the same capacity each time. We think about things like neglect, so things that didn't happen that should have. So comfort, attunement, and having your needs met and acknowledged. And I think sometimes what I see in kind of neurodivergence and that kind of transgenerational, what we have a lot of mothers and grandmothers that were misdiagnosed or undiagnosed, and that has led them to experiencing their own traumas. And what we find is there is a lack of attunement. So that lack of being able to tune into your child's needs and think, oh, you're crying. What might you need? What can I do for you? Whereas with someone who's experienced their own trauma, that crying might then kind of bring up some shame and go, oh, I'm not a good enough parent. And then you disconnect from that parenting. So then the child isn't having those emotional needs met, right? And I think these things are really kind of interesting and kind of powerful to explore. And we might also think about enmeshment and role reversal, right? So the kind of, does the child become the emotional caretaker for the adults in their lives, right? Does the child's kind of needs come last, or were they not visible? Were they completely invisible in the household, right? So then food does become the thing that you can control. So if I can't control what happened to me, I can control what I put into my body, right? So people who grow up in unpredictable and unsafe environments, food can become a rare kind of territory of agency, right? So kind of restriction as control, binging as a form of release, food as a kind of a way of self-protection, is kind of creating predictability. Food refusal as protest, right? Not eating is the one no that you can kind of have some control of, right? So there are some kind of, this is where we're starting to get a little bit more sensitive with some of the psychology, the psychological meaning behind our relationship with food, right? So it's always important that even when you're kind of listening to these things, just be mindful of what's going on for you, for your own body, and how you're feeling. And if it gets too uncomfortable, you know, you can turn this off, you can come back to it at a later date, right? But these are the kind of ways that this kind of lack of control in childhood can show up as kind of control through food, through eating, through not eating, through kind of binging, through restricting, through sports and fitness, and how calories kind of play into that and the control. But this kind of emotional neglect and this invisible wound is about this kind of what was consistently absent. It leaves no visible marks, and it's often kind of really unrecognized, but even by those who experience it. It's things like when your emotions were dismissed, they were minimized or ignored. Physical needs were met, but your emotional needs weren't. Nobody asked how you were feeling or really listened. You learned that early that your needs were a burden. You were praised for your self-sufficiency and independence. You developed elaborate ways of coping entirely alone. So like if no one taught you that your needs matter, how then do you find and establish what your needs are as an adult in order to kind of feed yourself and nurture yourself, especially emotionally and kind of literally, right? There's this thing about, if I was never nurtured, if I was never fed, if I was never given anything nutritious, whether that was emotionally or kind of food wise, how do I know how to do this to myself? How do I know to take care of myself? And I think for so many of us, right, and I can identify in this, you're not alone in this, right? Your feelings, your experiences, you're never alone in these things, right? So it's very easier for us to kind of put other people's needs above our own and become people pleasers, and this kind of abandonment of self. And how this abandonment of self then kind of plays up in food or in life is these big feelings of resentment underneath the surface. You know, I have given everything to everyone. I've been at work all day. I've been tidying up. I've been looking after the kids. I've been looking after the dog or the cats. You know, I've done everything. Who's going to look after me? No one looks after me. Why should I look after me if no one's going to look after me? Or I'm so exhausted looking after everyone else. How am I supposed to look after me now? You know what? I'm not. I'm just going to get myself a takeout because I'm tired. What do you mean I have to cook a meal for myself, right? That kind of self-talk that's kind of going on underneath the surface, whether that's you're conscious to it or not. But both of these voices, they're grief. It's the grief. They're both asking the question, like, you know, am I allowed to matter? Was I ever allowed to matter? What does it mean to matter? What does it mean to center myself, right? So this kind of chronic self-neglect can kind of look like forgetting to eat, not preparing food, choosing the last option, the habit of treating your own needs as least important, this disassociation from hunger, so years of ignoring physical cues to keep functioning for others until the body signal becomes genuinely hard to read. Collapse eating, so finally stopping, burn out, the body taking over, eating anything and everything as an attempt to refuel what was never replenished. Resentment of cooking, so cooking for others every day while running on empty. Food prep comes loaded with pain. So eating itself becomes adverse, right? So this is not always a thing, but this is sometimes a thing, and you can see how easy it kind of intertwines with neurodivergence and how us being neurodivergent can kind of almost make us kind of more prone to falling into some of these categories as well. So I think it is really important to understand where we might be kind of fawning in our survival responses and how this can impact our relationships with food, and not only our relationship with food, but our relationship with self-care, our relationship with being able to look after ourselves. And, you know, these are big subjects. I'm trying to cover them, but I could kind of almost go into like an hour webinar for each one of these slides. I just want to kind of showcase how big of a subject they are. So some of the things that, you know, it can show up as well, like always kind of preparing for others first and leaving ourselves to last, right? Making nice foods for everyone else and then like just picking at the scraps of everything. I'll eat what no one else eats. I'll just kind of pick as I'm eating and not kind of really feeling and nourishing ourselves. And this kind of feeling like your own hunger and your own needs are inconvenient, they're too demanding or they're too much, and almost kind of apologizing internally for feeling hungry, right? I think there's so much in this in relation to being able to like identify what parts of you need feeding and what parts of you are feeding. So if there's something called internal family systems, if you want to kind of put a language to this. I am trained kind of psychodynamically, so I think about it slightly differently, but I think these two models intertwine. But we think about kind of what are the different parts of ourselves. So when we're binge eating or when we're eating crap, when we know we could be eating better, what part of ourselves are we feeding and why? What part of ourselves in that moment are we starving or not feeding? You know, kind of what is our relationship with food feeding on an unconscious level, right? Is it about our nervous systems? Is it about feelings of safety? Is it resentment? And it's important that, you know, all of these things are going to intertwine. So yes, there might be a part of this that is, you know, as neurodivergent women, we will fluctuate throughout the month with our hormones and how that will affect our symptoms and our brain fog and our cognitive functioning. But also, you know, as we're fluctuating, do we still put other people's needs before our own, or are we able to take the time and slow down at certain periods of the months, or as we kind of reach certain milestones? You know, how do we relate to ourselves when we have kind of cognitive dysfunction once we're starting to get into those stages of burnout? Do we allow ourselves to rest, or do we start to feel guilty and feel shamed? And this is where this kind of some of this trauma can intertwine with us being neurodivergent as well, right? And the relationship and how it needs to be kind of examined and kind of looked into a little bit further, right? It's never kind of one or the other. It tends to be an intertwinement of a few things together. So what can healing look like? So naming the pattern. So kind of thinking about kind of what was my experience, being able to put some words to it. Reparenting. I think there's real power in being able to reparent yourself. And it can sound a little silly and it can look a little silly. And for me, it's like, okay, something's going on for you right now. What's going on? Because I feel like this fluttering in our chest. I feel like, you're really anxious and you're really craving chocolates. You really want to eat sweets and you're telling me that you don't want to eat a proper dinner. What's going on for you? What do you need right now? Okay, you feel like you've done so much today and no one's been thankful. That must feel really horrible and really uncomfortable to sit in. I'm really thankful for the things that you've done today. I think you've done a really good job looking after everyone today, and I think you really deserve to look after yourself. So how can we make a compromise? Because I can see that you need a little bit of respite right now and a little bit of like maybe some dopamine and some fix. Do you think that you could have a nice dinner? And maybe, okay, maybe you don't make it as big as normal. You maybe it's slightly smaller, and then you can have maybe let's look at kind of using those extra little bits of space in your tummy for dessert. And maybe that dessert could maybe be dark chocolate rather than milk chocolate. How does that feel for you, right? That kind of reparenting yourself in the moment. And when I first saw people doing that, it was cringy. I was like, oh, why would you do that? The more I started practicing it, the more I started to realize actually, no, that's what I need, because there's this little girl inside of me that needs a bit of parenting and needs some attention. And it doesn't matter that I'm like big old woman over here. We've been through our experiences and our experiences kind of need that work to heal, right? Community and co-regulation. Use the Project You community, right? This is what we're here for. We're here to support, we're here to be in relationship with each other, we're here to say, I know like me and Leanne and Ash, we all say it all the time, we're not coming from a place of sitting on a pedestal and like, oh, we're better than you, we know all of this stuff. We're all kind of neurodivergent women. We're all kind of going through our own journeys and have had kind of very similar, if not the same experiences to many of you, right? Grief work is important. Allowing yourself to grieve the care that you did not receive. And this is like a very important step. Trauma-informed therapy, so internal family systems, EMDR, somatic approaches, brain spotting, all of these things help. And compassion before change, being compassionate to yourself, giving yourself grace. Trying to fix eating without addressing the kind of worthlessness beliefs almost never works. Self-compassion is a must, right? So some support strategies here. And again, you will get the slides, and this will be this will be a recording as well. So I've got some stuff here. So speaking to your GP, the NHS has an eating disorder service. I put autism and ADHD assessment. If we can get that, that is always a positive. I know that there are a lot of kind of systemic blockers in the way. You can speak to a diet, you can get a dietitian referral through the NHS. You could also come and work at Project U or work with me if you're already in Project U, and we could do some work around kind of disordered eating if that you feel like that is showing up for you. And again, so some of the strategies that can help. So safe food stockpiling, having trusted safe foods, reliable, available resources reduces baseline nervous system anxiety. So it's okay to have safe foods, right? Last month in the calories and the macros one, I was saying, I was going through a big transition at the time, and I probably had the same meal 4 or 5 days a week for at least a month. Because that was all I had the spoons for, right? And I tried to make sure that it was protein, carbs, and some salad, some fiber, and some greens. It wasn't the greatest meal plan in the world, but it worked for me for what I was going through, right? And the important things that I didn't feel shame or guilt for kind of eating the way that I was eating, right? There was other things going on. Food chaining, so very gradual introductions, introducing small varieties of accepted foods. So ideally with a trauma-informed therapy. So I'm a trauma-informed nutritionist if you want to come work with me. Reducing the shame narratives. So again, that could be kind of work on yourself, some personal development work, working with a therapist, working with a peer community to gently unpick kind of beliefs and words around food. Nervous system first. So I think kind of nervous system work is extremely important. We may never be as regulated as our neurotypical counterparts, right? So we're not looking for perfection in our regulation, but what we can do is find what feels safe for us, right? In a world that constantly makes us feel unsafe, we can figure out what makes us feel safe, what works for us, right? Sensory exploration, so kind of being able to explore foods, routine and predictability. Another thing that I didn't add here, but I will just kind of add on top of this is I do believe that there is a space for um, supplements and kind of shakes, soups, smoothies. So again, not necessarily going for a food first approach. And sometimes, especially if we've had kind of disordered eating for so long and we have, nutritional deficiencies that might be affecting our energy levels and our executive functioning, working with a nutritionist, working with a healthcare provider to have some supplements first, just to help with some of that energy production and that kind of capacity to think about food may also be beneficial, right? So again, there is some signposting and resources. It's always important to know that you are not too much. In some cases, it's you were not looked after enough. And these strategies are to help you to develop to survive. The strategies that you've developed to survive were intelligent. Those strategies now affect your eating and make complete sense. And you are allowed to receive care now, including from yourself, right? So this more so for those of us who have been through some of those traumas, some of those lived experiences that mean that it's become a little bit harder to nurture ourselves, to care for ourselves, and to feed ourselves, right? And for those of us that are kind of having difficult relationships with food for many reasons, right? It's always important to understand that, your relationship with food is valid, your experiences is valid, and, we don't ever want to create an environment where there's any shame around that. Give yourself grace, give yourself compassion. And if and when you are ready to kind of look into it and make some changes and kind of do some of that work, then we're here for you, in whatever capacity that can look like. Um, it's just coming to 7 o'clock. If there is anyone in the chat that has any questions, please feel free to kind of ask them now. And if not, I will leave you for your rest of your evening. I'll give it a couple of minutes. Thank you, thank you. I'm seeing good feedback in the chat. And if anyone has any kind of comments or questions, feel free to just ask on the replay. You can put the comments down below. If you are in the Project You community, then you can ask questions in the app. And then we'll make sure that we will also put some information in on the YouTube kind of channel on how to get some more information from kind of Project You, how to sign up, how to have a discovery call with Leanne. The information will all be down there. Thank you very much for tuning in, and I look forward to seeing you again. For those in the Project U community, the next one will be at the end of March, and you should have the date in the Project U app. And I will see you then.